Now I would like to call Dr. Pooja Hingorani, distribution of ophthalmic causes of headache among patients presenting to a tertiary hospital.
Good afternoon, everyone, and it's the last of the day, and basically, it's not moving ahead. Yeah. So basically, we all know that headache is a universal complaint. WHO says that up to 47% people do have headaches in their life, and it can have multifactorial, extensive classifications. That's the reason sometimes the patients don't know where to go, which specialty to go to. So though they are mostly benign and can be diagnosed with minimal workup, some of them are vision and life-threatening, and some of the vision-threatening ones are like glaucoma, which is in our ophthalmology field. And sometimes referrals are not established, SOPs are not made, and because of that, some cases get delayed for their diagnosis. The tendency is that the neurologist takes care of the headache, and then they usually do not refer to an ophthalmologist, and many patients are being indefinitely managed as a suspect case of migraine, etc. And these come very late with cases like glaucoma, etc. So our study was divided into two parts. The upper was that we wanted to know what type of referral pattern is there in a tertiary hospital, which headache patients are referred to what all OPDs, how many are referred to ophthalmology, when they are referred to ophthalmology, what are their spectrum of diagnosis. And in the second part, we wanted to see if all were first diagnosed to ophthalmology, are we getting more ophthalmological diagnosis? So the first part, as I said, was observational cross-sectional. The second one, it was qualitative, quantitative mixed, and our community medicine people said it's called quantitative, and it was a comparative study. So the inclusion criteria were there should be new patients having headache as primary symptom, and we had three forms of getting the patients. One was through the screening OPD, one was directly online, the patients would register, and we had no control over that. And the third was through another OPD, referred through another OPD. The exclusion criteria were old patients or known glaucoma patients. And so we had, we started this off as a pilot study. So we had the existing pattern of referral followed by an interventional part where we wanted all to be first referred to ophthalmology. So this was what was done. Initially, they were referred to any department, and those who were felt to be ophthalmological diagnosis were further referred to ophthalmology. In the second part, which is blue, they were all referred to ophthalmology, and when we didn't have an ophthalmological diagnosis, we referred them to other departments. So in the first phase, we saw, of course, a slight female preponderance. 4% of the total patients coming to the screening counter of our hospital had complaints of headache, and this was the referral pattern. Only 17% were referred to ophthalmology, most of them to medicine. So these were the three. They were self-registered and directly through screening, or those went to screening to other departments and were referred to us. So this was the first week, the first phase. This was the distribution of the patients who came to us in the ophthalmology OPD. Amongst the first set, those come from screening. 75% had an ophthalmological diagnosis corresponding to all the blues. And amongst those patients who referred themselves, 68% had an ophthalmological diagnosis. And of course, the patients who were referred from the other doctors, all of them had an ophthalmological diagnosis. This was in the second phase where only 3% of the total OPD patients had headaches, but they were all sent to ophthalmology, and from ophthalmology we had to send them to these OPDs. This was the comparative of both the weeks of the patients we got. In the screening, those who came from screening, 52% had an ophthalmological diagnosis. We had to refer the others. And amongst those who self-referred, 39% had an ophthalmological diagnosis. So this was the distribution of those who, amongst each group, those who had an ophthalmological diagnosis. This is telling us about, in the first week, how many of the totally screened patients who had a headache finally got an ophthalmological diagnosis, versus in the second week, a greater amount of patients got an ophthalmological diagnosis. The limitations of our study were that it was very small sample size. Sometimes some days of the week have more holidays, etc. There was a dropout, elective, new only were taken. And finally, this was a summary of the findings. And we would say that if they were referred to ophthalmology first, it means that they were getting more of an ophthalmological diagnosis. It just goes, it's like a fight for the ophthalmologists who would say that most of the headache centers in the world, and India, there are only 4 headache centers, and they're all run by neurologists. So this is a fight that says that if something like this is published, then we should have more elective postings for MBBS students, more fellowships. There should be multi-speciality centers, and the presence of India in international societies. Unfortunately, everywhere in the world, headache is being managed by the neurologist. In fact, in America, the fellowships, which are 1 year long, don't even have an ophthalmic posting. So this is a fight and case for all headaches should be seen by ophthalmologists, and I think a 175% rise of ophthalmic diagnosis in the week 2, though it was a pilot study and we could not do a lot of statistics analysis.
It is an interesting study. What were the most common orthoptic conditions which you found in your headache cohort?
So most of the cases in our these were of course.
Did you run any test or did you do any kind of orthoptic checkup in these patients?
Yeah, so we the thing is that it was almost like the screening, a basic diagnosis which was come up was an ophthalmic diagnosis, mainly refractive errors, computer vision syndromes, and these were the main causes of headache which came up as an ophthalmic cause of headache. Many of these are otherwise would have been diagnosed as suspect migraine or something like that elsewhere. When they actually come to us, and we started running elective posting since 2 years, and we are getting, maybe we'll do a qualitative on that because we're getting reflections of the students, MBBS students also. Like, they don't even know that there are 9 specialties involved, and you know, the neurologist, the dentist, the ENT, the orthopedician, the ophthalmologist, they should all be involved, not just the neurologist. In the
my question was, did you do any orthoptic examination, and what orthoptic examination did you do, and what were the most common orthoptic conditions which you found in your headache cohort?
So we did not do a very, we had excluded children.
I think you should include that thing.
Yes,
you should.
but we had excluded children because of the mere reason that in our hospital it is compulsory that under 18 everyone should go to pediatrics first. So we could not take, we had to take only adults. So for this kind of a study, we just could not manage to change the rules and get them all here. And for the adults, we didn't do a very detailed orthoptic examination.